Hello friends, welcome back to our YouTube channel Doctorscorner. In this particular video, we are going to discuss a very small topic today, which is known as dangerous area of the face. Okay, dangerous area of face. So it is basically a clinical anatomy question. So it can be a 3 marks short, 3 or 5 marks short notes or short question in the theory university examination. So dangerous area of the face. So also it can be asked in the ENT subject also. Okay. So anyway, we'll continue. What does this dangerous area of face mean? So let me directly come to the point. If you see this particular part of the face, that is this region, that is the upper lip, the lower part of the nose, and this adjacent area. So this particular zone of the face, it is known as dangerous area of the face. Okay. So let me first describe the parts of the dangerous area of the face. Then we'll discuss about the clinical significance, why it is called so, and all. Okay. So first thing is, I'll repeat, upper part of the lip, lower part of the nose, and this adjacent area is known as dangerous area of the face. Okay. Conversely, it can also be called as dangerous triangle of the face. Okay. Sometimes it is termed as dangerous triangle. Okay, of the face. So again, what is this dangerous triangle of the face? It is same. So that is this triangle formed by the corner of the mouth and the bridge of the nose. Okay, so this particular part of this triangle which is formed, it is known as dangerous triangle of the face. Okay, sometimes termed as the death triangle or the triangle of the death. Okay, so why it is called so, dangerous triangle or the dangerous area of the face? So there is some significance for this. The clinical significance, why it is called so and all. So let me explain. So to understand this, you should know the basic anatomy of the face, that is the venous drainage of the face. Okay, so mainly there is a facial vein, right? This facial vein drains this part of the particular dangerous area of the face, which I have already described. So you should know that this facial vein will communicate with the cavernous sinus. Okay, so the cavernous sinus is present in the cranial cavity. Okay, within the intracranial cavity, this cavernous sinus is present. Okay, we will not go in detail what is cavernous sinus and all. It is a part of the venous system. So there is a communication between this extracranial vein, that is facial vein, and this intracranial venous system, that is the cavernous sinus. So this facial vein communicate with this by two routes. One route is by the deep facial vein. Okay, so this you should know first. Facial vein is formed by this two union of the supratrochlear and the supraorbital vein. Okay, so they will form the angular vein, which will continue as the facial vein, right? So this facial vein will continue as the deep facial vein, which will go to the pterygoid venous plexus. Then where the emissary veins, it will go to the cavernous sinus. This is one route. Another route is from this angular vein. Again, there is a communication via superior ophthalmic vein, which will in turn drain into the cavernous sinus. Okay, let me describe this in a further with a different diagram. Okay, again this is the same venous drainage diagram of a face. So this is the facial vein. So one way of communication of this is facial vein by the deep facial vein. It will go to the pterygoid venous plexus, and from pterygoid venous plexus via the emissary veins to the cavernous sinus. Emissary veins, which will communicate extracranial to the intracranial veins, right? So ultimately, it will. You should know the pathway. That is facial vein, deep facial vein, pterygoid venous plexus, emissary vein, and the cavernous sinus. Okay. Then second route is through this angular vein. Angular vein, that is the part of the facial vein only. So this angular vein communicate via the superior ophthalmic vein into the cavernous sinus. So okay, let me show you one more diagram to be more clear. Okay. After this, you should be able to know the pathway of the facial vein, how it communicates with the cavernous sinus. You can see there are two routes. One is this facial vein. With the help of this deep facial vein, it will drain into the pterygoid venous plexus, and again by the sphenoid emissary veins, it will drain into the cavernous sinus. So this B route. Okay, facial vein, deep facial vein, pterygoid venous plexus, emissary vein, and cavernous sinus. Similarly, from this angular vein, okay, which is a part of the facial vein itself, so from this superior ophthalmic vein, it will drain into the cavernous sinus. Okay, so there are two routes. So ultimately they will drain into the cavernous sinus. So what will happen? Suppose if there is any trauma, injury, or any infection on this particular part of the face, that is so called dangerous area of the face. So what will happen? So the blood from this is drained by the facial vein. So from the facial vein, the infection or the organism, microorganism is transferred to the cavernous sinus. So if it goes to the cavernous sinus, that is the intracranial cavity, that is into the brain. So directly from this extracranial vein, it will go to the intracranial veins, that is cavernous sinus. So this will cause the inflammation in the cavernous sinus, something known as cavernous sinus thrombosis. So ultimately the problem is this. So any infection, furuncle or boil, if it is deep enough to be drained into the facial vein, and it will carried by this communications to the cavernous sinus. So in the cavernous sinus, due to inflammation, it will lead to the thrombus formation in the cavernous sinus. So what will happen if there is a formation of the thrombosis in the cavernous sinus? So basically what will happen is, so there are certain important nerves and the vessels which are present in the cavernous sinus. So let me highlight the important nerves, like cranial nerve 3, cranial nerves 4 and 6. Okay, this particular nerves which will supply the extraocular muscles, also the first and second division of the trigeminal nerves. Okay, and very important artery, carotid artery, so internal carotid artery, so also pass from this cavernous sinus. So ultimately what happens, if there is a cavernous sinus thrombosis, these important structures may get compressed, and there will be some defect in the function of this particular thing. So let me highlight you with some case study. You can see there is cellulitis or something, there is infection on this dangerous area of the face, that is on this nose. Okay, in this particular case, and you can see there is a ptosis, that is drooping of the upper eyelid of the right side. So ultimately it has drained to the facial vein and went to the cavernous sinus, and there is a thrombosis of the cavernous sinus, and this the important cranial nerves which I have already described, which will maintain the movements of the eyeball and this eyelids. Okay, that is affected, and there is a ptosis. Let me explain you with one more case study. You can see again in this particular patient, so you can see here there is a trauma to this dangerous area of the face. Okay, an injury which causes certain infection, which is ultimately transmitted to the cavernous sinus, and you can see there is deviation of the eyeballs. Okay, medial deviation of both the eyeballs, periorbital edema. Okay, so these all things will occur. Okay, these are the signs of the cavernous sinus thrombosis. Okay, apart from this, there can be a fever, headache, vomiting, and periorbital edema. Okay, ptosis, ophthalmoplegia. These are the signs and symptoms of the cavernous sinus thrombosis. We'll discuss about this in some other video. Right now, today's topic is dangerous area of face, which can be a 3-mark question in the ENT or anatomy. So let me revise quickly. So this part of the face, that is the upper lid, lower part of the nose, and this adjacent area is known as dangerous area of the face. Why it is known as dangerous area of the face is because any infection, injury or trauma or furuncle or boil, even the pimple or acne, okay, if it is if you pop up and it will cause us an infection, can transmit the infection to the cavernous sinus. How? Because there is a communication between the facial vein and the cavernous sinus. How there is a communication? By 2 routes. Okay, first route is by the deep facial vein, pterygoid venous plexus, emissary vein and cavernous sinus, and the second route is angular vein, superior ophthalmic vein and cavernous sinus. So ultimately facial vein can drain into the cavernous sinus. So it is suggested that how it will go, there is a retrograde movement of this veins. Ultimately it should drain into the internal jugular vein. By why means, because it is suggested that there are no walls in the facial vein in the superior ophthalmic vein. However, there are certain studies which disproves this this thing, like there are no walls. Okay, few studies have shown that even there are walls in this. But anyhow, due to this retrograde infection, flow of the infection to the cavernous sinus, which will cause cavernous sinus thrombosis, and it can be fatal. Okay, it can be fatal sometimes, and it can be dangerous, and it can cause the mortality. Okay, so that's why it is termed as dangerous area of the face. Okay, hope this video is beneficial to you. If you like our video, please subscribe this and share it with your friends. Thank you.